Welcome everybody to today's call. As always, if you're going to implement anything that you learn from this call, please speak with your primary care provider first. The information is up to date to the best of our ability at the date of this call. If you're watching this in the future, please check for updated info before taking action. So today, what else are we going to talk about other than COVID, right? But I wanted to share a couple of things that I'm finding in the literature because, believe it or not, each and every day the COVID literature is expanding. If you do a simple PubMed search right now PubMed has its own section for SARS-CoV-2. That's how much info is coming in. But so with those criteria, you can see here there's 17,850 studies available. So you can read yourself till you're blue in the face, but just as a sampling, they're looking at how is psoriasis impacted by COVID, how is MS impacted by COVID, how is lifestyle and quarantine and cardiovascular risk, GI, liver. So I want to share a couple of these today that I thought were interesting and relevant. So the first thing is that, COVID, SARS-CoV-2, coronavirus, whatever people are calling it, it's known as an upper respiratory tract infection, right? And so people are looking for cough and sniffles and those sorts of things. But what you need to understand is it's common for there to be GI complaints as well, and liver manifestations. So the GI complaints most commonly are diarrhea, nausea, vomiting, and abdominal pain. From a liver standpoint, it's more what we would see on the labs as a result of the COVID infection versus you having liver pain, so to speak. So in the labs, your liver enzymes are likely to be elevated. Those are AST, ALT, and total bilirubin, as well as lactate dehydrogenase. So why is this important? Well, there's the possibility that someone has GI issues and they're not aware that could be COVID because COVID's an upper respiratory infection, right? So they may have COVID and not know. And for most of the population, that's not a big deal. As we know, many are asymptomatic or follow a mild course of infection. But if you're someone with those comorbidities that include up there in age, 70 plus, and or hypertension, diabetes, obesity, cardiovascular disease, then this could matter because this could lead to a more severe course of infection. And it's, they say in this paper, this is the World Journal of Gastroenterology, by the way, they say in this paper, despite being frequently overlooked, involvement of the GI tract in the liver is being increasingly reported. In fact, the first case of COVID in the US presented with nausea and vomiting in addition to the respiratory issues, and then later had stomach pain and diarrhea. So the thing that would allow people that have GI complaints and have COVID to not be missed is that most of the time they're having upper respiratory symptoms and GI symptoms, but there are a few cases that they mention in the literature where they were GI only complaints. And so it's possible that could be happening. And the ones that they report, there was a 71-year-old female that reported with hemorrhagic colitis, and after they tested everything else to explain that, nothing was abnormal. They swabbed her nasopharynx, and she was positive for COVID. And then there's a 41-year-old lady in Michigan who had basically dehydrating diarrhea. So those two people were in the ER anyways because of the GI complaints driven by COVID. So just so you know, it's possible to have GI manifestations. And so don't be, if you know someone that is in a high risk group and they're having upper respiratory stuff, but they're also having GI, so like, oh, maybe it's a gut bug, not COVID. Well, it could potentially be COVID. So if they're a high risk population, elderly plus comorbidities, and they haven't been checked out, they should be checked out. If they're healthy and 25, probably don't need to worry. So that's the GI and liver aspect. Then we have the impacts or potential impacts of quarantine, right? So I know Linda and I have discussed this over time. It's been a hot topic all over the place. Is could the impacts of quarantine be worse than the impacts of the coronavirus itself? And there's been many doctors and people coming out saying, well, absolutely, look at the economic impact, et cetera, et cetera. One of the other issues is that due to the lockdown or due to um, the coronavirus, say, fear, many people with comorbidities are not getting the care they need because they're scared to go to their doctor or go to the hospital to get that care because they don't want to get coronavirus. So if you're somebody, say, with a cardiovascular disease that needs to be managed on a regular basis, say you are on warfarin or blood thinning therapy and you have a therapeutic INR that needs to be monitored monthly with your cardiologist or your GP, and they're not doing that because you're scared to go into the office, there's a potential that you could fall out of therapeutic range and then have a clot. Or if you have hypertension that isn't being managed, there's lots of issues there. So that's where the quarantine could make us worse. And excuse me. And so it's not COVID, by the way, just a tickle. You can't catch it over Zoom anyways. But so quarantine, you see here, quarantine carries some long-term effects on cardiovascular disease, and also unhealthy lifestyle and anxiety are where the main relations are, because when you're locked up, you're not getting the exercise you need and you're anxious about when do I get out of here. So you can see in this big quote here, the potential benefits of mandatory mass quarantine need to be weighed carefully against the possible long-term effects. Well, what could the long-term effects be? Anxiety, depression, anger, fear. Multiple doctors have said suicides have increased, addiction has increased, child molestation has increased, spousal abuse has increased. So these are things that are, say, secondary effects that maybe weren't considered when we went into this nationwide lockdown and quarantine. And then a big focus of this paper, because this is the Journal of Lifestyle Medicine, they say, obviously the lifestyle thing that's most likely to be impacted during quarantine is your physical activity, right? If they're telling you, hey, stay in your house, and you're scared to go outside and exercise, or you relied on a gym and now you don't have those materials at your house, your health can suffer that way. Perfect example, I have multiple Parkinson's disease patients, and there's a local gym that does boxing classes for Parkinson's patients, and the patients love it. It gets them out, it gets them in community, it gets them physical activity, which drives the brain, et cetera, et cetera. Well, they can't do that during the lockdown because gyms aren't allowed to be open. So unless they take initiative now in their home and figure out some way to exercise, they're suffering and maybe progressing down the wrong road as far as Parkinson's goes. So that's something to consider. The study talks about nutrition. So if we're locked in the house and there's shortages of foods, or I'm locked in the house and I'm scared to go out, well, if you had healthy food at first and you ate through that, now you're left with unhealthy food. So you can see that nutrition habits will change due to reduced goods, reduced availability. This can have negative psychological effects, including post-traumatic stress, confusion, anger. Stressors included longer quarantine duration, infection fears, frustration, boredom, inadequate supplies, inadequate information. Financial loss is a huge one, and stigma, right? Should I wear a mask? Shouldn't I wear a mask? If I wear a mask, people look at me weird. If I don't wear a mask, people look at me weird. What do I do? And I thought this was interesting. If we have inadequate basic supplies like food and water, that's a source of frustration, obviously, during quarantine. But they found that continued to be associated with anxiety and anger 4 to 6 months after raising of the quarantine. So, and this is obviously studying previous quarantine situations because ours isn't totally lifted yet. But that's long-term psychological and behavioral effects that can't be necessarily quantified when we're making the recommendations. So you guys get it. People will stress eat, stress drink, and that's what leads to increased addiction behaviors and maybe abuse and that sort of thing. So just telling you what you already know is that the research is supporting it now, that, hey, the quarantine isn't benign in and of itself. Flattening the curve isn't necessarily a worthy goal if these things are all going to happen. So the take home is obviously, as best you can, get out there and get active. With the nice weather coming, get out and get exercise. Once the gym's open, get back in your routine. Do your best to preserve the optimal nutrition that you've integrated and hopefully has become your lifestyle. And then, educate others around you. Maybe invite a friend out to work out and help spread the cheer instead of the fear. So any comments or questions on any of that?
Fully aware of that. And I've taken the opportunity to spend this time cooking much more healthy food, more interesting international stuff. And as tough as it is, I dial up YouTube and do whatever I need to do. And now I'm back working with my personal trainer and been doing high intensity intervals with a small group. So that's been very nice.
Good. And you guys are more on the positive spectrum of things. So I've looked at it the same way, as how can we leverage this as an opportunity instead of a bummer, right? So you've gone to diversifying your palate and your repertoire in terms of cooking. For me, it's been, hey, how can I focus on my kids and get more quality time there, right? Because they're not at school, they're not on the bus at 7 a.m.
Yeah.
And home at 3, and we miss that whole day with them. So we get that time. My wife has become confident that she could homeschool if she needed to, and lots of neighbor time and just enjoying the weather. We happen to have the longest spring in North Carolina that I've had in my 11 years here, which is really nice too. So how about you, Adam? Any comments?
Yeah, I definitely agree with, the research here and getting outside more. I've been walking a lot more with my neighbor. There's been times we're walking 4.5 miles, 5 miles a night.
Nice.
So just trying to keep busy and, not having the gym kind of, dampens that. But hey, it's a lot better walking outside than walking on a treadmill.
Oh yeah, much better. And
the only thing that I miss right now is the weights and stuff like that. But
yeah,
at least I'm outside.
Yeah. And they're coming. Hopefully it opens up soon. But while you're doing the walking, a simple thing to do is maybe just add intervals to it. So if you're going 5 miles, you could do, okay, we're going to just walk conversational pace for 2 telephone poles, and then let's power walk for 2, and just make that heart rate vary, which is that's the very healthy stimulus from the interval training. And then, you could do the same thing. There's a workout called a Tabata structure of a workout where at home.
Those are bears.
Yeah, they are. But you could just pick 3 body weight movements, say push-ups, sit-ups, and air squats, right? And so you do 8 sets of 20 seconds on, 10 seconds off. And, that like Linda said, that'll sufficiently smoke you. And in about, I forget what the math is, but in like 8 minutes or so, you're laid out on the floor and you're on with your day. No weights necessary.
I did some last week and I had my heart rate at 184.
Nice.
Wow.
Yeah, if I do the push-ups, it's amazing how quickly your rep total falls. It's like 10 seconds rest isn't enough, So but again, that's another big time stimulus for you. And insulin sensitivity, interval training, especially at high intensity, is a big time insulin sensitivity promoter. So really helps with the blood sugar, really helps stimulate your metabolism. So try implementing that this week as we wait for gyms to open. And
definitely do that.
Give us some feedback. Any other questions or comments on this?
Just to Adam's point, I discovered that I don't have the array of weights at home either. When I moved, I didn't bother to move them. I have some. But, you can do push-ups, you can do sit-ups, you can do a variety of other things. I mean, your own body weight works pretty well for push-ups. And if you get down on the floor, you know, I do 4 or 5 sets of 20. And I wasn't ever doing that at home, but I've quickly, I wouldn't say I've regained what I've lost, but I'm getting closer.
Yeah. Yeah. 4 or 5 sets of 20 is good. Your arms are shredded if they're on camera, I bet. All right.
That's not bad. I've been working for a while. You know, when you're at my age, you have to work at it.
Good. That's the key. Consistency is the only magic bullet, right?
That's correct.